My colleague Shana Saroshe from the Dana-Farber is actually leading a study in which she's trying to see the outcomes of patients with Waldenström's who are taking BTK inhibitors, specifically Ibrutinib, and to see what happened with those patients when the dose is decreased. Usually we dose decrease Ibrutinib in patients with Waldenström's to manage side effects. Instead of stopping the therapy and switching therapies, we still think that there is a way that patients can continue benefiting from the therapy just by adjusting the dose of these agents. So Dr. Saroshe actually published a paper earlier this year looking at our database at the Dana-Farber, looking at dose reductions, and we saw that about a quarter of the patients needed a dose reduction, but actually the majority of these patients maintained the response and continued benefiting for years after the dose reduction, so it was actually a very interesting outcome. So we went back and looked at other databases in trying to understand if this observation that we had actually is reflected also in other experiences. So this abstract that she's presenting this year is a separate independent cohort of patients with Waldenström's that also were on therapy with Ibrutinib, and the dose was reduced for specific reasons. Most of them were side effects and toxicity, but we were also able to see very similar outcomes in the sense that patients were able to sustain the response. And interestingly enough, in the patients in which the dose, in whom the dose was decreased, they were able to stay on therapy longer than patients in whom obviously the therapy was stopped and then switched to a different therapy. So I think this is an important aspect of things because I still believe BTK inhibitors are probably the most effective single agent therapies for patients with Waldenström's, and having a resource to the clinicians to manage the toxicities rather than switching to another therapy and discard this potential option for patients to continue benefiting from these treatments. So I think that's the value of this study. Obviously, we don't have data with the newer BTK inhibitors like Acalabrutinib or Zanubrutinib, but we're going to be looking into these agents as well in the future.